MCPHS has long been known for our history in healthcare and the work that we've done in building so many different opportunities for our students over a 200-plus year history. So when I think about the School of Healthcare Business and Technology and the history of Massachusetts College of Pharmacy and Health Sciences, I think about our futurists and our founders. That was a way we were looking at how we got to our bicentennial. And we tend to pick up on the futurist aspect, looking toward the future, thinking about the elements of technology and how that drives healthcare. As an institution, we look very closely at interprofessional education, and we look at healthcare as a team sport. And we know that every person who comes into healthcare has a purpose, so our team members have a purpose. And we look at technology and the work that we're doing within the school and within our programs as uniting that focus on the purpose of healthcare and using technology as a vehicle to improve and focus on the patient at the center of healthcare. Yes, we're a business school, but we have a much more holistic approach to how business fits within healthcare and how technology will move healthcare forward in the future. So healthcare is evolving rapidly, and the school takes steps to ensure that we are on top of that rapidly evolving healthcare, technology, and all those different elements. We build on the history of MCPHS in the futurist perspective, and we look at the industry connections that we have, not just here in the Longwood medical area, but also across the state in Worcester, but we have students all over the world, and we have a real strong opportunity to create those collaborations, not just with our students, not just with our alumni, but with world-class organizations that are right here outside the door. And so we listen to our partners, and we have some strong partnerships like working with Mass Tech Collaborative and working with the Mass eHealth Initiative. And from those relationships and those partnerships, we learn a lot about what our industry partners are looking for, what our students can do, and how we can fill the gaps that they have. In particular, we know that technology, we know that informatics, we know that we have a role in the future of healthcare. And so we pay very close attention to what our partners are telling us from an industry perspective and from the research perspective and also from the experiential opportunities that we provide. Graduates from the School of Healthcare Business and Technology are differentiated from other business schools by our focus on interprofessional education, for one. We are also differentiated by our values within the school, which focus on entrepreneurial leadership, innovation, and the use of technology to enhance care for the patient at the center of their care. We also focus on collaboration and resilience. And those are skills that are incredibly important in today's workplace. And then we think about the School of Healthcare Business and Technology, and we recognize that we have a role in catalyzing the use of technology to drive healthcare for the future. And so that's one thing that other business schools don't do. And that's something that makes us different. And it relates to that team purpose that I was talking about before, where we have students who are part of a team delivering care. That includes the business function, that includes informatics, that includes data science. These are all areas that are critical to research, critical to the delivery of care, and critical to the future of healthcare in the US. Our students have experience that other students in business schools do not have. And we run that through our experiential opportunities, we run that through our research opportunities, and even opportunities like traveling to London to compare the National Health Service to the US Health Service. Those are things that we do that differentiate our students from other schools. Real-world experience is built into our programs in really 4 distinct pathways. And one of the things that we are very focused on is the fact that students can make their own decision as to what experience they'd like. We have students who can take internships. We have students who can conduct research with a faculty member or as an independent study. We have the opportunity for international travel. And we have the opportunity for students to, through their coursework, participate in what we call field placement. So through those 4 different opportunities, our students get a chance to experience real-world learning, gaining skills, and in some of our programs we have opportunities for even multiple internships and multiple electives, which can include research with the Center of Research and Discovery, with a faculty member, there's so many great ways students can gain experience, and we want to make sure that we're harnessing all those for our students. So to give you more perspective, we work very closely with the different centers for excellence here at MCPHS, including the Center for Research and Discovery, the Career Development Center, Center for Life Sciences. All of these centers bring together great opportunities to focus on specific areas that matter to our students and deliver the skills that they're looking for and the experiences that they're looking for. We also create opportunities for travel. We have a course, it's an elective, any student can take this course. It's focused on the US Health Service and comparing that to the National Health Service in England. And we actually travel to London to make that comparison. So we have some fun while we're at it too. Our online students have the same opportunities for experiential components to their education as our face-to-face students here in the Boston campus. The same opportunities for internships, the same opportunities for research through our Center for Research and Discovery, and the same opportunities to have international experiences with our travel course to London or through our Center for International Education. All of that is exactly the same. We also have some experiential components built into our courses directly. For example, in our informatics program, students have a field placement. The same is true for our data science program online. So we have many opportunities for our students to gain experience and the experience that they want, so they can choose from all of those different options and what fits their need for skills development, their particular preference best, and we're happy to work with that in any way possible. From healthcare analytics to management, our programs span a huge area in healthcare. So when we think about what students might decide is their major or what's of most interest to them, it's important for the undergraduate student to know we have a core curriculum that's the same for all students. And from that core curriculum, we have opportunities to learn about different areas and different facets of healthcare. We have electives that students can use to focus in specific areas. We have experiential opportunities for students to do research in an area that's of interest to them. So when you think about that span of programs and ensuring that this is the right fit, we have lots of opportunities and we have lots of ways in which we can look at leveraging technology and care and focusing on what's most important to the student. Looking at our alumni, we have some really exciting outcomes that have happened recently. I think where we should start with this, though, is to think about how our students are working with our existing alumni to find relationships in the workplace. I think a good example of this is Vihan, who graduated last year. Vihan was a student who volunteered. He participated in shadowing or job shadowing. He worked with the Career Development Center, and he interviewed for an internship with an alum who also works with us here in the school. And so through all of those steps, Vihan had an opportunity to experience the workplace, to work with someone who was an alum, and all of that helped him to get hired full-time after he graduated at Boston Medical Center. We have other great examples like Kelly, who's at Biogen. We have Michael, who is a senior director at Mass General Brigham in the Office of Medical Specialties. We have Jordan Diosa, who's working as a client specialist in Orlando. We have some really great outcomes for our students. We also see some students who have come back for a master's degree and then gone off to be extremely successful with clinical skills matched with business acumen. And that creates a very strong relationship for a lot of these healthcare institutions that are seeking that type of skill. The School of Healthcare Business and Technology leverages the broader ecosystem that surrounds MCPHS in a number of important ways. Number one, we are looking at our alumni connections here in the Longwood medical area, but in hospitals. We have 1,700 alumni working in the top 7 hospitals in Massachusetts. That gives you a sense of the influence that we have as an institution. But the important point is that those alumni have sat in the same seat. They understand the value of the MCPHS education and who you are and what you're going through as a student here. That has value when we look for internships, when we look for opportunities of employment, and when we create collaborations with these world-class organizations. If you look across the river to Cambridge, we have the #1 biotech hub in the world. We have probably the best medical area in the world here in Longwood Medical Area. The level of experience that is here, the number of people who've started careers in the Longwood Medical Area, who've gone out to take on huge challenges in healthcare, it's immense. But that ecosystem also provides us with talent. That talent comes into our classrooms with our faculty. It comes into our classrooms with our students and the experiences that they have around MCPHS. We have really strong opportunities based on where we are in this ecosystem. And it expands past just hospitals. It includes research in pharmaceutical companies and biotech companies and life sciences. We have so many strong relationships here at MCPHS with industry partners in this area that it's unmatched. I don't think any other school can point to their level of connection with the ecosystem that surrounds them. Looking ahead, the School of Healthcare, Business, and Technology is focused on 4 specific strategic priorities. The first is driving innovation with technology and expanding the use of technology in the delivery of healthcare. That's #1. #2, we're focused on delivering learning that is engaging our students in the places where they are, using technology in the classroom, using opportunities to leverage technology in their learning. The third is creating a technology infrastructure that supports our students and supports learning in a meaningful way. What I mean by that, an example is our data science desktop for our data science students. They have access to cutting-edge tools and software programs in their own individualized desktop. That kind of infrastructure allows us to deliver our education, support it with technology, but make it personalized to each student and give opportunities to conduct research and use programs that evaluate data, large data sets. And that is something that we focus on in all of our programs, to be honest with you. Bringing in data-driven decision-making and using data available in healthcare to make strong decisions. Another focus for us, or the fourth focus, is entrepreneurial leadership. We look at each of our students as a leader, no matter what. But thinking from an entrepreneurial standpoint where opportunity comes from innovative practices, or thinking about what we can do that's different, or finding ways that we can solve a specific problem in healthcare. This is a very complex environment, and entrepreneurial leadership means that our students are focused on improving healthcare, but taking advantage of changes that they can make and understanding what change leadership is and bringing that all forward. So bringing these 4 pieces together, these 4 strategic priorities, and thinking about what the future is for our students and what they can expect is the use of technology in healthcare and the ability to use technology while learning here as a student and figuring out what that means in the future. I think we can all agree that the future of healthcare is definitely going to rely on technology, communication, information about patients, data analysis, data science, machine learning. These are all elements that are going to drive healthcare in the future. When we look at AI, for example, we know that there are strong possibilities of AI being involved in many aspects of care. It certainly will not replace care. It will enhance and advance care. And I think that's something that's really important for us to focus on in thinking about those priorities I outlined and how the future of healthcare looks and what our students will experience when they're in our programs.